here live and unscripted, your Stanford and Harvard trained anesthesiologist, and I'm going to share with you what happens when patients are lonely and they go under anesthesia, like in this real life operating room. As you may have heard recently, the U.S. Surgeon General, Dr. Vivek Murthy, just announced a loneliness epidemic. And that has great consequences all over medicine, even when you're under anesthesia having surgery, because loneliness has very real effects on your body. Physical signs and symptoms come up when patients are suffering from unmitigated or untreated loneliness. And that shows up when you're connected to the ventilator behind me and when you have anesthetics on board, and even in those moments when you're breathing through that mask, getting the oxygen and other anesthesia gases. So let's talk about what happens to patients who are lonely. And it wouldn't be right to start without a real life story. I had a 75-year-old patient not too long ago coming in for a knee replacement. And when he sat down on the table, I gave him the oxygen mask. And before I gave it to him, I said, "What are you looking forward to doing with your new knee?" Because I want patients to wake up, or rather fall asleep, with that sense of positivity, to set a seed in their mind for what they're going to feel like when they wake up in hopefully a positive way, help reminding them the purpose, the meaning of why we're having surgery in the first place before that scary mask goes on. What did the patient tell me? What do you guys think the patient told me? What do you think the patient told me? And by the way, Alexis, Heidi, Linda, Chris, great to see everyone on here, so many others. But I want to know, oh, hey, Gentle Spirit, thank you for being a new subscriber. Your support helps me do this more often. So I'll give you a shout out to whoever gets it right. What did this patient tell me? When their head was on the pillow, they're getting ready for a whole new knee replacement. Sherry got it right. Sherry says he wasn't looking forward to anything. So this patient, unbeknownst to me, had a serious disconnection with their family and their social circle and was suffering from a serious social and emotional type of loneliness. There are 3 types of loneliness we typically describe, and he was suffering 2 of those 3. When he told me, in this moment here, I don't even know why I want a new knee anymore. This was really concerning for me, as you could imagine, and it impacted their anesthesia. So what happens when you have this level of loneliness? A couple of things happen. There are often contributing factors that show up on the monitors in your heart. This patient, not surprisingly, was also suffering from depression. The people that he used to do his physical activities with, like jogging, running, weren't around anymore. That was why he had originally wanted the knee replacement. And like Darlene says, it is sad, and there is an element of hopelessness in here. This is not the time to be having surgery, because when you fall asleep, what signs are manifested in your body? When you fall asleep with that level of hopelessness or loneliness, it increases your risk of heart disease. It increases your risk of stroke. It increases your risk of Alzheimer's type dementia, which when you're waking up from anesthesia, after all these gases have wreaked havoc on your brain, the sevoflurane, the laughing gas here, N2O, the liquid anesthetics like propofol or ketamine or whatever they might be, midazolam, opioids like fentanyl, the pain of the surgery, these can all unmask what we call emergence delirium, causing you know all those stories I've shared with you of people that wake up kicking, screaming, doing all these wacky things, because the brain, when it has been lonely for so long, is so prone to depression, to generalized anxiety or state anxiety. These are real conditions, and they really show up on the table, and they are preventable. It's not a fatalistic diagnosis. It's not a terminal diagnosis. It's one of the remarkable realities of the human body. We have nearly unbound resilience. Of course, it's not easy to tap into. And I'm not saying you should feel bad if you feel lonely, because that's also counterproductive. But this patient even had a tremendous amount of resilience innately in there. It was covered up. What did I do with this patient? What did I do with this patient? This doesn't happen all that rarely, to be honest. This was a more serious type of example, but I paused. You can't just put a mask on someone, tell them to take big, deep breaths of oxygen and funny smelling gases. Just, you can't do that to somebody who just told you that they don't even know why they're having this major surgery. Because what's going to happen if they have this surgery? They have an increased risk of delirium, an increased risk of side effects from the anesthesia, most importantly, pain. Worse pain after surgery. How do you treat pain in the elderly? You give them painkillers like opioids. What do opioids, if given in excess, or if they're not addressing the root cause of pain, what do they do to the elderly? They increase the risk of dementia. Oh, I should say delirium, which may, we don't yet know for sure, but may increase the risk of long-term consequences. I want to always do less is more. Well, less is more, but truly the right amount is the correct amount. If they have an underlying reason for their pain that we're not addressing and just throwing opioids at them, that might raise the risk of side effects after in the elderly. And we don't have ways of reversing those side effects. So I did pause. And believe me, I was the least popular person in the operating room that day, because nobody likes a delay to surgery, and especially nobody likes it when anesthesia causes a delay. It's like, if you have any friends who work in hospitals, it is the least favorite thing of anyone. They call it an anesthesia delay. And it's really frustrating, but no, we had to take a pause and check in about why are we doing this. I asked the surgeon to come by. We had a little last minute talk. Was it the most ideal? Probably not. I wish we could have done this talk 1 week ago, or 2 weeks ago, or a month ago. But given the circumstances of the broken healthcare system that we worked in, I asked the others to leave, not be chit-chatting and whispering, this person's so undecided, so insecure. All that judgment does not help a patient who's struggling with that degree of loneliness and concomitant depression when they're on this table. Linda says it's a meat factory. I can't disagree with you, Linda. I can't disagree with you. Now, I got to do a couple shout outs here. Java, good to see you. Autumn, I'm so happy to hear that you had successful knee replacements. And so many fantastic comments. Chrissy says, good morning. It's afternoon here. I had dental treatment under IV sedation, midazolam. I remember waking and moving in pain. I'm happy that you're all better now, but I'm sorry that you had that experience. But that is what midazolam does. I don't actually have any more. I've already wasted my midazolam for the day, but I give it nearly every day. It is relatively safe in the dentist office, but it doesn't always cover the pain. Darlene says the elderly need soft touch, eye-to-eye contact. You are so correct, Darlene. You're absolutely correct. So I want to just raise something else up here. This is about Generation Z, because loneliness isn't just for the old people. Do you guys know any Gen Zers, these young kids that are addicted to their phones? I'm going to have a whole video on what Gen Z patients are like under anesthesia, so please be on the lookout for that. But suffice to say that Gen Z has a degree of loneliness that is in some ways unprecedented ever in human history. Before I actually tell you a little bit more about that, just a quick shout out, as you know, well, I guess a shameless plug rather. After a long day in the operating room, I'd appreciate it if you do appreciate what I share with you, to hit that like button or share with others or subscribe to keep up with all of my lives, where I share your potential to heal in ways that you probably never thought possible, and what happens in the subconscious that's opened up under anesthesia. So I really appreciate your support and of course sharing what you've learned with others to help others advocate for themselves in, like I said, the broken healthcare system that we unfortunately live in. So yeah, Gen Z is kind of a curious one. Someone already said social media. Let me give them a shout out. Proud American says, yes, it's social media. When I'm talking to patients before they come into the operating room, you may not believe this. Hey, Sterling, thank you so much. I'm talking to patients about what's going to happen to their body under anesthesia, on this bed, on the ventilator. And more often than not, they're texting on their phone while I'm talking to them. I don't mean any disrespect to anyone. I'm not making fun of them, but I'm raising a really powerful point that their attention, and this is not all Gen Zers. Hey, there are some very, very mature Gen Zers out there. It's not all of them, but it's enough that I have a serious concern about where is the focus. Before something like surgery, I would hope that my patients, I've called them the night before, a little bit of preparatory, just answering questions, helping them feel prepared. I want that mindset to be in the right place when we enter this room. Remember, you walk through this door here, you come in to this room, and I want your mindset to be focused on you and healing. Not you in an egocentric way, but your healing. When somebody is on their phone before their surgery, we already know that social media can be anxiety-inducing. It is likely a distractor from that focus and that attention on healing the self or preparing to heal the self. Very curious. I don't know what your thoughts are. Do please let me know what you think about that. I think that it's a little bit difficult to communicate when someone's glued to their phone texting. When I'm doing nerve blocks on patients, some patients continue to text while I'm doing the nerve block. And it's a balance because it might be a form of distraction to distract from the discomfort of the needle, and I respect that. There's a time and a place for distraction in short bursts, not in over long term. Similar for suppressing certain feelings. But when it's unbridled, it's concerning to me. What else do Gen Zers do? They use sleep aids more than other folks. So when they're lonely, and then that might be contributing to depression or generalized anxiety, they're more likely to grab a sleep aid or grab alcohol than others. And that can also be concerning because those have very real effects under anesthesia. If you can see my videos, they're very, very real effects that happen to your body when you go into that subconscious plane under anesthesia. Redheads also need, and they need some, they need more anesthesia for some of the medications, higher doses, I should say, not all, but that's an interesting point you bring up there. It was Kathleen, or no, Jean Hibb says that. Have I ever dealt with someone with autonomic dysreflexia? Yes, I have, Josiah, and it requires very careful management. Very good question. So the Gen Zers, though, let's not get distracted here like the Gen Zer stereotype. When they are reaching for sleep aids more frequently than others who are lonely, it raises concern for not addressing the root cause of loneliness. And when we don't address the root cause, we put Band-Aids, and these Band-Aids all have side effects, whether it's the marijuana, the alcohol, the sleep aids. So these have implications under anesthesia for the reasons I said earlier. Just like for that 75-year-old, the 17-year-old also is priming their body for a lifetime of complications. This concerns me, and it concerns Dr. Vivek Murthy, the Surgeon General. If you've ever felt isolated like that or lonely, and I should say that loneliness and boredom share some similarities, but they're different. And they both need to be addressed and not gaslit. Absolutely not gaslit. So I hope that if you've ever known anyone who's lonely, that you take an extra step to say hi to them, because ignoring them or pretending like it's just, they're lonely, whatever, isn't doing them any good and may have, well, it does have real risks to our heart health, our brain health, even our immune system potentially, and weakening our immune system. So the more connected you are, not just you feeling better. When you say hi to that person who you think is lonely, when you know the signs of loneliness, you should be able to read the signs of loneliness. They're pretty intuitive. People that are withdrawn, not engaging with others in physical activities, maybe not going to a religious activity or whatever, church, not engaging in recreational sports, perhaps appearing uninterested, what we call anhedonia, very serious. Perhaps they are exhibiting other signs of anxiety or depression. They have sleep disturbances. They're not eating. These can all be symptoms of loneliness. When you say hi to that person, if you can help re-engage them, what do you do for them? Well, if they're having surgery, you can help their pain be less. Decreased opioid requirements are consistently noted in patients who feel more connected, as are faster recoveries, what we call shorter length of stay. So you can leave the hospital faster after your surgery the more connected you feel. And of course, there's less anxiety and less pain, like we said, emotional pain and physical pain. That's the power of connectedness. So if you have an opportunity to help give even a smile, I would appreciate it if you do that, because you have more power over your health than you've ever been told, and you probably have more power over other people's happiness and health than you thought possible without medications. You don't need propofol, you don't need gases or laughing gas or the benzodiazepines. They might make you feel good in the moment with those chemicals that target your brain and hijack your, your central nervous system, but with your presence, your mindful presence to establish that connection, you have incredible power, and it's, like I said, more than you've probably ever been told. So if you could share that message to help empower others to advocate for themselves in our broken healthcare system, I wish you the best in that, and I would really appreciate that. If you also like the message that we talk about here, hitting that like button is always appreciated, and subscribing to keep up with the lives. Until next time, have a good weekend, and remember that you have that incredible power. It's your presence. And you can't overdose on your presence, nor are there any side effects from it. Not many medications fall in that category, I'll guarantee you that.